Pain under the left breast can have a range of causes from digestion to heart conditions. Home remedies may be enough to treat some conditions, but others could require medical attention. Organs in the upper left region of the body may be the source of pain under the left breast. This include the stomach, heart, lungs, ribs, colon, pancreas, spleen. The most common causes of pain under the left breast are often grouped into different categories, including heart-related, digestive, breast-related. This video looks at the different causes, symptoms and treatments of pain under the left breast. Is pain under the left breast a heart attack? A heart attack happens when the blood supply to the heart suddenly becomes blocked. This is often caused by a blockage in a nearby artery, as the heart is situated slightly to the left of the mild line in the upper body. Pain under the left breast may indicate a heart problems. It is estimated that every 40 seconds someone has a heart attack in the United States. Is it a heart attack? Heart attacks occur when there is a lack of blood supply to the heart. Symptoms include chest pain, pressure or tightness, pain that may spread to the arms, neck, jaw or back, nausea and vomiting, sweaty or clammy skin, heartburn or indigestion, shortness of breath, coughing or wheezing, lightheadedness or dizziness, anxiety that can feel similar to a panic attack. Treatment options will depend on when the symptoms start and how soon the person having the attack can access the first stage of care. If the cause of the attack is found to be a blocked coronary artery, the doctor may recommend a procedure called an angioplasty to open a blocked or severely narrowed coronary artery with a balloon and possibly place a stent. Heart-related causes. Angina. Angina occurs when the heart muscle does not receive enough oxygen in the coronary artery blood supply. This may cause pain under the left breast or in the center of the chest, which may also spread to the arms, jaw or neck. Feel tight, heavy or sharp. Be triggered by physical exercise. Stop soon after resting. Other symptoms of angina include lightheadedness, nausea, shortness of breath, fatigue. Angina is a possible symptom of severe underlying heart disease, so anyone experiencing symptoms of angina should seek medical attention immediately. Treatment may involve prescribed medications such as beta blockers, ACE inhibitors, statins, aspirin. Pericarditis. The heart is surrounded and protected by a thin layered fluid-filled membrane called the pericardium. Pericarditis occurs when this becomes inflamed due to infection or a disorder or the body's immune system attacks itself. Symptoms of acute pericarditis include sharp, stabbing pain under the left breast or in the chest, pain in one or both shoulders, pain worsening when taking a deep breath or lying down on the back, feeling hot, sweaty, feverish, lightheaded, and short of breath. Immediate treatment for pericarditis may include over-the-counter anti-inflammatory medication like ibuprofen and rest until feverish symptoms decrease. If a person experiences severe pain, a doctor may prescribe a steroid like prednisone. A person may also need to stay in the hospital for monitoring. Gastritis. Gastritis is when the stomach's lining becomes inflamed. Not everyone experiences symptoms, but a sharp stabbing or burning pain under the left breast is a potential clue that gastritis may be present. Pain may also be accompanied by heartburn, indigestion, feeling sick, vomiting, bloating. Treatment for gastritis will depend on its cause and whether it is acute or chronic. Some medications may include antacids, antibiotics, proton pump inhibitors, H2 blockers. Some home remedies may also help alleviate symptoms, including reducing alcohol intake, eating smaller portions more often as opposed to one big meal, cutting out dairy, spicy, fried or acidic foods and caffeinated drinks, cutting down or giving up smoking, reducing high intake of over-the-counter non-steroidal anti-inflammatory drugs, eating foods high in fiber and plant nutrients. Pancreatitis. Pancreatitis is inflammation of the pancreas. Acute pancreatitis has symptoms that include sudden severe pain under the left breast and in the upper center part of the abdomen, nausea and vomiting, rapid pulse, fever. Chronic pancreatitis, or the condition worsens over time, has symptoms including frequent or prolonged episodes of pain under the left breast that can spread to the back, nausea and vomiting, oily, pale-looking stools, diarrhea. For acute pancreatitis, immediate treatment includes intravenous fluids to aid in hydration and ensure the body's other organs have good blood flow, giving intravenous pain medication or anti-nausea medication. Treatment for chronic pancreatitis ranges from pain management and using increasing strength of medication to surgery if pain under the left breast is still severe. Heartburn. Heartburn happens when stomach acid travels back up the food pipe and causes a burning sensation in the mid-chest and throat, and sometimes pain under the left breast. Heartburn may be a symptom of indigestion and stomach acid issues. Symptoms include a tight, burning sensation in the upper chest or throat that sometimes travels under the left breast and the jaw, a bitter taste in the mouth, pain under the left breast or in the chest while lying down or just after eating. Treatment for heartburn may include a combination of medications like antacids and home remedies such as not eating big meals, not lying down, to sleep right after eating, raising one's pillow. Breast-related causes. Pain under the left breast may also be caused by breast trauma, infection, or hormonal changes. Breast surgery. Different types of breast surgeries may cause pain under the left breast, including breast augmentation, breast reduction, mastectomy, such as to treat breast cancer. Depending on the type of surgery, it may take up to 6 weeks to fully recover. During this period, a person may feel the following symptoms: pain in the shoulder, arm and neck of the area that got operated on, swelling and bruising, changes in sensation, discoloration, scarring. In some cases, people may experience an infection which could cause pain, sickness, and oozing from the wound. If a person notices signs of an infection, they should get medical help immediately. Milk duct conditions. Milk ducts carry milk from a person's mammary glands to their nipples when they are breastfeeding. Some conditions may develop inside the left milk ducts and cause pain under the left breast, including clogged milk ducts, breast abscess, yeast infection, mastitis, mammary duct ectasia, fibroadenomas of the breast. A person should see a doctor if they notice a lump in their breast, experience heat, swelling, and tenderness in the breast, have a clogged duct that does not go away after 2 days, have fever-like symptoms. Injury. A traumatic breast injury to the left breast may also cause pain. It does not, however, cause breast cancer as is commonly believed. Common causes of breast injury include being hit while playing sports, falling, a car collision, repetitive movement of the breast such as running, using a breast pump, breast surgery. In some cases, traumatic breast injury may also cause a breast hematoma to develop. A person should get medical help if they suffer a traumatic breast injury. Other causes. Pleurisy. The lungs are surrounded by a layered membrane called the pleura. Pleurisy is when the pleura surrounding one or both lungs becomes inflamed due to infection or another cause such as rheumatoid arthritis, lung cancer, pulmonary embolism. Pleurisy of the left lung may result in pain under the left breast. The most common symptom of pleurisy is a sharp chest pain when taking a deep breath, but it can also be accompanied by pain in the shoulder, a dry cough, shortness of breath. The pain can get worse when the person walks around, coughs, or sneezes. Treatment for pleurisy will depend on the severity of the condition and symptoms. If a person experiences particularly severe chest pain, they should seek immediate treatment from a doctor who may prescribe non-steroidal anti-inflammatory drugs or other pain-relieving medications. A doctor may also carry out further tests such as blood test, chest X-ray, chest CT scan, biopsy. Pleurisy caused by a viral infection often gets better after a few days, but a bacterial infection will require antibiotic therapy. Spleen. The spleen can cause pain under the left breast if it is enlarged or if it bursts following an injury. Symptoms of an enlarged spleen include tenderness and pain under the left breast, feeling uncomfortable when eating even just a small meal, anemia and extreme tiredness, bleeding easily. A burst spleen will typically cause pain under the left breast or ribs, tenderness when touched, bleeding, dizziness and fast heart rate. If a person suspects a burst spleen, they should get immediate medical help. Bleeding can be life-threatening if left untreated. A doctor will check for an enlarged spleen by feeling the abdomen and may recommend further testing through blood testing or imaging such as an abdominal ultrasound, CT scan or MRI scan. Underlying conditions such as chronic liver disease and subsequent cirrhosis can affect and interact with the spleen. A doctor will prescribe medication when medical therapy is possible to treat splenic or liver disease. Surgery is only required if underlying causes cannot be diagnosed clearly, or if complications arise from the enlarged or damaged organ. When to see a doctor? Some conditions can be treated at home with rest and over-the-counter medication, but people should seek medical attention straight away if the chest is injured. The pain under the left breast is unexpected. Symptoms of pain and tightness do not get better with rest. Shortness of breath, feeling sick, or profuse sweating accompanies the pain. During pregnancy, pain experienced under the left breast during pregnancy may be caused by pressure from the top of the uterus or as it grows, or if the baby is kicking or punching the expectant mother. The pain can be worse when leaning forward. Muscles and other tissues will stretch as the baby grows, and this may also cause pain under the breast. The expectant mother's body changes during pregnancy. As the baby grows, the internal organs will be pushed and moved. The rib cage may change position, and the expectant mother may experience heartburn with acid reflux.